The OMNI main screen now uses a tile-based layout. There are 3 views: big tiles, mixed tiles, and details view. All parameter tiles are interactive. Tapping the bottom of a 2-piece tile opens a keypad for value entry. Tapping the top opens the details view. The key parameters highlighted on the main screen from the left to the right side are pressures overview, AP, FP, VP, PD. Menu bar at the bottom. Main, history, functions, blood flow. Key icons: blood pump, heparin, heparin bolus, syringe change, patient care, other settings. On the right side of the screen, the heparin bolus is available. To activate it, press the icon. Enter the volume you want to infuse and confirm it. On the right side of the screen, the patient care icon is highlighted. Press the button to take care or mobilize the patient. The blood flow automatically decreases to 50 milliliters per minute. By pressing again the patient care icon, the blood flow will increase to the set flow rate. By pressing the other settings, you can access further functions and information, including day and night mode settings, screensaver adjustment, clean window activation, the service menu, the date and time, and the switch off button. To change to night mode option, press the other settings icon, then press day and night mode. You can set the brightness of the screen and the audio volume of alarms separately for day and night mode. The modification of the brightness also dims the brightness of the green LED at the top of the machine. The service menu can be reached by pressing the other settings and then the service icon. The information in this menu can be useful for service technicians to diagnose the machine. The user can see here an animated real-time flow scheme of the therapy. The screensaver can be enabled or disabled, and the activation time can be adjusted during therapy through the other settings menu. The screensaver allows you to visualize from a distance of 10 meters, 6 key parameters, and a clear view of the filter schematic. These parameters can be, for example, the next intervention, the blood flow, venous pressure, arterial pressure, pre-filter pressure, pressure drop. The appearing parameters can be customized in the TSM, user configuration. To clean the touchscreen without modifying the parameters, press the other settings, then press the clean icon. The touchscreen will be unresponsive for 10 seconds. On the OMNI main screen, you will see a set of interactive tiles. To adjust the heparin flow rate, tap the corresponding tile, enter the new value, and confirm. The elapsed therapy time is automatically calculated and displayed as tiles in the big, mixed, and detailed view. All changes are logged and can be reviewed in the history menu. Level regulation window can be reached by pressing the levels icon in the functions menu. This window displays the 2 chambers on the blood side. If the automatic function is on, the level will be adjusted automatically in the chambers. If the fluid level is too low or too high in one of the chambers, you can adjust the fluid level by pressing the arrows. The syringe change can be initiated from either from the frame or from the functions menu. Press the syringe icon on the frame. The syringe pump is stopped automatically while the blood pump continue running. Clamp the heparin line. Open the unlocking lever and syringe holder. Remove the syringe from the holder and disconnect syringe from line. Select the syringe type and set the new volume of the syringe. Connect the new syringe and insert it into the holder. Make sure you open the clamp on the heparin line. Press Confirm. The volumes of heparin administered to the patient and the treated blood volume in the therapy are continuously measured and logged in the treatment history. To visualize the volumes, press History on the main screen. Then the Volumes submenu on the screen pops up. You can select an interval time on the left upper side with a start and end time, or see the total volumes, including the blood volume and the heparin of the current shift. If you press New Shift, the current values will be reset to 0. By pressing Total, you can see the volumes administered during the whole treatment in table form. By pressing the Graph button, you can visualize different parameters. You can view the blood side pressures, like arterial or venous pressures, and the heparin flow rate. You can enlarge the graphs by pressing the icon. You can select the date and the time you want to view. To view the full list of events, select Event Log. By pressing the report, you have a full view of the current treatment, including all the volumes exchanged and removed. Press Main to go back to the home screen. Press the functions, then select Temporary Disconnect Patient. Clamp the arterial and the venous line and disconnect them from the patient. Connect arterial to the venous line with the recirculation connector, then open clamps. Hang the lines on the IV pole and press Next. Press Recirculation button to start recirculation. The blood flow is adjusted at 50 milliliters by default. If reconnection to the patient is not intended, it is also possible to unload the kit instead. To move from recirculation to patient reconnection, press Recirculation again. Press Reconnect. Change therapy parameters if needed, then press Confirm. During patient connection, only white connection is available. Follow instructions on the screen. Blood flow can be adjusted. Adjust blood flow rate if necessary. The Enter Therapy button becomes enabled after 25 milliliters of blood delivered. Press Enter Therapy.